Maharashtra's public health system is currently facing significant challenges, as highlighted by various reports and expert assessments. Here are the key issues and failures of the government in addressing them. Current challenges in public health in Maharashtra. 1. Insufficient funding. The allocation for public health in Maharashtra is critically low, with only 4.2% of the state budget dedicated to healthcare. This is below the recommended 8%, leading to inadequate resources for public health initiatives and infrastructure development. 2. Staffing shortages. There are approximately 18,000 vacancies in the state health department, including 1,600 doctors' posts and 16,000 other key positions. In rural hospitals, 61% of specialist posts remain unfilled, severely impacting healthcare delivery. 3. High mortality rates. Recent reports indicate alarming rates of patient deaths in government hospitals across Maharashtra, with incidents of over 100 deaths within a week across several districts. This raises concerns about the quality of care and hospital conditions. 4. Poor urban health infrastructure. Despite having the highest urban population in India, Maharashtra ranks poorly in terms of public hospital beds, coming in at 13th place. Urban health services remain underfunded and underdeveloped, with only 10% coverage for outpatient care in certain areas. 5. Malnutrition and anemia. The state faces severe public health issues such as high rates of anemia among women, 54%, and significant child malnutrition, with Maharashtra recording the second highest stunting rates in India. Despite these issues, budgets for child nutrition programs have been cut. 6. Lack of regulation in private healthcare. There is inadequate regulation of private hospitals, leading to non-compliance with pricing transparency and patient rights laws. The government has not effectively enforced existing regulations, resulting in poor accountability within the private sector. 7. Inadequate response to tribal health needs. Tribal populations continue to face unique health challenges that are not adequately addressed by current policies or healthcare infrastructure. The prevalence of diseases such as sickle cell anemia remains high without sufficient intervention. Government failures. Neglecting public health priorities. The state government's budget allocation for public health has decreased year on year despite evident needs highlighted by the COVID-19 pandemic. Failure to fill vacancies. The government has not effectively addressed staffing shortages, relying heavily on temporary staff instead of regularizing positions for healthcare workers, which undermines service quality. Inaction on malnutrition and child health. Budget cuts to child nutrition programs indicate a lack of commitment to tackling malnutrition and improving child health outcomes despite high rates of stunting and anemia. Insufficient infrastructure development. While new hospitals are being announced, there is a lack of focus on improving existing facilities and ensuring they are adequately staffed and equipped to handle patient needs. In summary, Maharashtra's public health system is grappling with critical funding shortages, staffing issues, high mortality rates, and inadequate infrastructure, all exacerbated by insufficient government action to address these pressing challenges.